Good afternoon, everyone. This is the Board of Health meeting scheduled for Tuesday, February 20th at 3:30. My name is Thomas Corey. I'm joined by Michael Coughlin and Dr. Stephen Gagliardi, Tess Curran, our agent of the board, and various guests. Pursuant to the open meeting law, any person may make an audio or video recording of this public meeting or may transmit the meeting through any medium. Attendees are therefore advised that such recordings or transmissions are being made, whether perceived or unperceived by those present, and are deemed acknowledged and permissible. Can we have a roll call?
Thomas Corey,
Yes.
Michael Coughlin,
Here.
Stephen Gagliardi.
Here.
The first item on the agenda is the approval of the minutes of the Board of Health meeting held on January 23rd. Are there any additions, deletions, or corrections to be made to the minutes of the meeting as printed?
No. Move to accept. Second.
Can we have a roll call?
Thomas Corey,
Yes?
Michael Coughlin,
Yes.
Stephen Gagliardi.
Yes.
Okay, next we have a request for the approval of a tattoo practitioner license for Christopher Conti of 67 Doyle Avenue in Rhode Island to work for the Forever Tattoo Company at 1412 South Main Street.
No, él tiene que estar viendo, ¿no es cierto?
Who's presenting?
Que es presente, dice.
Who's-
Não és você. Ai, doce mais.
Who's presenting on Chris's behalf?
I believe that's supposed to be Josh.
Is that Josh?
Yep, that'd be me.
Okay, Josh. All of Christopher's documentation is in order?
Yes, it is.
Any complaints?
No, sir.
Gentlemen, any questions?
Nope. No.
Do we have a motion to approve?
So moved. Second.
Can we have a roll call?
Thomas Corey,
Yes.
Michael Coughlin,
Yes.
Stephen Gagliardi.
Yes.
Christopher, good luck. Thank you.
Awesome. Thank you.
Thank you. Good luck.
Next, we have a public hearing for 1191 Wood Street. It's a septic system repair. That's why Mr. Aguirre is with us today. Mr. Aguirre, give us the story here. I want to thank you for the 82 pages of delightful bedtime reading.
Well, we try to do things right. And a lot of this, for this one specifically, was the technology that was being proposed for the septic repair, which is one of these Presby systems. So it's an innovative design that's been approved by DEP for tight situations like we have here. I don't know if there's anybody here on behalf of the applicant, but if not, I'll give a quick little presentation of what.
I'm here,
There you
Jack
go.
Sargent with Outback Engineering, I'm representing them.
All right.
Do
Go ahead.
you want
Why
me
don't you
to-
rip first, and then I can give you my comments.
Okay, yeah, so, basically.
Mr.
what we're-
Sergeant, Mr.
Yes.
Sergeant, could you state your name and address for the record?
Yep, Jack Sargent of Outback Engineering. Do you want our company's address?
Yes.
Or, 165 East Grove Street, Middleborough, Massachusetts.
Okay, thank you.
Welcome. Do you all have the plan, or do you
Yeah.
Well, I have looked at the plan, yes.
Okay. So what we're doing, based on the constraints of the site, we're using a Presby system out in front of the house to avoid the pond there as well. We, based on Dan Aguirre's comments, we pushed the system a little bit to the north, so we'll be able to drain it so it wouldn't be draining into the abutter's property, I'm sorry. And I believe we also modified it so we moved the water line and have it so they'll encase it in concrete as well. I guess, and we're asking just for some local upgrade approvals, really, setback between the, proposed leaching field and the existing property line. Based on the site constraints, we have it from the, front, I guess it's the front or side property line. We have it about 1.5 feet from that instead of the usual 10 feet. Reduction in the between the proposed septic tank and the existing foundation from 10 feet to 5 feet, based on the site constraints again as well. And the reduction of the required setback between the proposed septic tank and the existing water service from 10 feet to 1 foot. And the reduction of the required number of deep holes per disposal area from 2 to 1.
So, Mr. Chairman, if I could, again, Dan Aguirre, Director of Engineering and Planning for the City of Fall River. Jack is correct. We've gone back a few times with some comments regarding this proposed design. I can offer that I would recommend approval of the 4 local upgrade approval variances. Specifically, with regard to item number 1, it should be called out that the request to a reduction to 1.5 feet setback to the westerly property line and 5 feet to the southerly property line. And the reasoning for that was to make sure that stormwater that was being directed towards this property did not run to the adjacent property, which is Diane Gouveia. She has been notified of this hearing. They have submitted the green card certified mail letting her know of the date and time of the meeting. So you do have that in your package as well. Other than that, although being very tight and in a very specific location near the South Watuppa Pond, this is about as good as you're going to get without a tight tank on this property. Luckily, this is a situation that the house is on municipal water. It does not have a well. The abutting properties are also on municipal water, so that alleviated a big issue down here in this location. So I would recommend approval of the plan the way that it has been presented.
Okay. Gentlemen, any questions?
Sounds like they have it under control.
Mm-hmm.
Motion to approve.
I'll second, but I did have a question. Have we heard any opposition from anyone in the neighborhood?
No, we have not. And I had maybe about a year ago, subsequent or before this petition came in, I had met with Ms. Gouveia about a seawall issue that she was working on in her property. And it's a very tight area. Everyone is on top of each other. That's why I wanted to make sure that, that she was notified in accordance with the rules and regulations of Title V, which she was. If you recall, last month's meeting, we actually tabled so that we could make sure that this notification took place. So no, we have not received any call, comment, or notification about it.
Okay, all right, I'm good.
Can we have a roll call?
Thomas Corey,
Yes?
Michael Coughlin,
Yes,
Stephen Gagliardi.
Yes.
Okay. Thank you very much for your time, gentlemen, and I hope it all works out well.
Great, thank you.
Thanks.
Okay, I'm going to introduce Michaela Perry. She's our epidemiologist, and I guess she has a report for us today. Welcome.
Hello, thank you. Yes, I do have a respiratory season update with
Actually, Michaela, can I just
Yeah.
interrupt you really fast before you start? Because I don't want to interrupt your presentation once you get going. But Tom, it looks like we have some folks from our last meeting on the Zoom regarding the chicken coop, but Faust and team there, we hadn't put that on the agenda, so we won't be able to discuss that today regarding, because there was the issue regarding the coop not being finished, so that hadn't been placed on the on our agenda, and so we won't be able to have, unless Tom, you want to try and discuss that in at the end of the
Um,
agenda regarding things that couldn't be added. But it hadn't been put on, so I'm hesitant to have a discussion today in terms of abutter notifications and the like. Because our office believes that there is abutters that do want to be present and voice their concerns. So we'll, Aline
know-
or Josh or Faust, do you have anything? Otherwise, we'll have to hold off. I just don't want to keep you guys
Yeah.
as the meeting goes on.
well, no, this is the Blackstone Street.
165 Blackstone. We do have another lady here for one that was for today.
Okay, on the 165 Blackstone, it's not on the agenda. There was already 2 opportunities to discuss this, and the board decided to table it twice now. And there were some issues with the building department, as I recall. Mr. Hathaway wasn't satisfied with the construction of the coop. So I don't think I should let it on today's agenda. If they want to reapply for next month, we'll be glad to entertain it then.
Yeah, we didn't realize that they were gonna be here today.
Okay, I just wanted to make sure. Okay. Thank you all. Sorry to interject. And Michaela, I'll pass it back over to you.
No worries. Yes, and I do have a couple of slides, so I'm going to share my screen real quick. Okay, hopefully you can all see that.
Yes.
Okay, perfect. So yes, I'm Michaela Petty. I'm the epidemiologist here with the City of Fall River, and just wanted to provide an update on where we're at in terms of respiratory illness season. Since this is my first time presenting to you all, I do want to provide some background on where this data comes from and kind of get us all on the same page. So when we're talking about respiratory illness surveillance, there's several different data sources that I use to put together these reports. There's the national, state, and local level data. And the overall goal of surveillance data, while it would be nice to have exact case counts, typically what we're trying to get is more of a sense of trends overall using reliable indicators. So at the national and state level, that looks like typically tracking emergency room visits, hospital admissions, at the syndromic level, which means looking more at symptoms because testing isn't always done. And then for the local data that I'll talk about today, that's pulled from individual case reports, which does rely on test results and wastewater data. So just kind of wanted to orient where this comes from and what those different sources are. To give an overview of kind of the big 3 of respiratory season, which is RSV, flu, and now COVID, this is the state dashboard, which is helpful to just kind of understand the overall landscape. And if you'll look, I've highlighted the current season in the yellow box. And this shows that hospital admissions for respiratory illness are decreasing, still elevated, but it looks like we've hit the peak, hopefully, for COVID, flu, and RSV. But one thing I kind of want to highlight here that's important that the state level data provides is those grayscale bars in the background indicate overall hospital admissions, regardless of whether it's respiratory illness or otherwise. And here at the beginning of the graph is 2019, so before the COVID-19 pandemic. And then you can see now we've continued to see elevated hospital admissions. And this has been kind of seen in the strain on emergency departments and hospital capacity. So this is just kind of something to be aware of and is helpful in the context of looking at the next couple of slides. So what this looks like in Fall River. So this is that case reporting data that I talked about This comes from Maven, which is the state reporting system. And these are case counts in Fall River at various time points. And one thing I think I want to highlight the most in this overall picture is the average number of cases in a month. So we saw about an average of 60 cases per week in January of this year, which is quite a bit higher than what we saw in previous years. So while cases are trending down for this year, we're still seeing elevated levels. And when you break that down by age, the largest majority is school-age children, especially those under 5, and then after that being those who are 80 and over. And next, we'll look at COVID, which is a similar but different story. So in terms of overall trends, it is trending down similar to the flu. This year, we've seen a lower average number of cases per week in January and February than what we saw in 2023. But it's still a relatively high value, kind of given that we're now getting more into a seasonal pattern of COVID. And the age distribution is also a little different. Still primarily in very young children and older adults, but we can see that those over 65 are a little more heavily impacted by COVID than what we see with the flu, at least based on our case reporting data. And one thing I want to highlight with this COVID-19 data, while we're seeing fewer cases reported to Maven, that can kind of bring up the question, is that just because people are testing at home, or is that an accurate representation? And this is where wastewater data has been really helpful. So anything in between the darker red line and this lighter red line is kind of the range you would expect to see during respiratory season. So there's elevated transmission, but not quite at the outbreak level, which is where we're hovering at the moment. And we'll hopefully continue to kind of overall trend downwards, but we're not quite at the peak that we saw in January. So that was a quick overview of where we're at, kind of what the trends are looking like. And now wanted to open it up to any questions or any type of clarification.
Is the RSV data impacted by better testing now? Because I know there's a lot more tests for the RSV.
That's a really good question. And unfortunately, not something I necessarily have access to in terms of like being able to analyze it myself. I know it was a big year for RSV, and we saw an earlier peak than normal, but that is tracked at the state level, so we don't have, I guess, it's a good question. I don't have a great answer for you right now.
Well, a few years ago, there wasn't really a, good testing for it, so you would presume it was RSV, but you didn't really know, and now it's part of the multi-pack test that everybody's using with the PCR testing. So you're going to get, more because you can test for it and get an actual answer, where before it was just kind of a presumptive diagnosis unless you did, viral cultures and things like that back in the day.
Yeah, that's absolutely a good point. I think that's also why during respiratory season, there's the like overall like acute respiratory illness, more like syndromic, to kind of track the overall trends. But yeah, actually that's something I'll kind of look for and maybe include in some future reports.
Because RSV has been around a long time, even when Tom was young. How far back it goes.
These
Didn't
diseases
test for
tend
it,
to
but
stick
we just
around
called it
once
a
they're good
cold.
at it.
Well, Michaela, it was good to see that both the state and the local data, but I wasn't able to really compare how we're doing compared to the rest of the state. Have you looked at that? Are our rates higher?
Our rates, when I've looked at them, are pretty on par. It's also difficult to compare the state level data directly to local data just because they use the hospital admissions, so it's percent of visits, whereas at the local level, all we have access to is the actual case reports in Maven. So they're a little bit different, but I would say in terms of overall trends, when you look at Fall River compared to the state, they're pretty similar overall. So hopefully that helps answer your question, but yeah, it's not easy to directly compare the two, unfortunately, because of where the data comes from.
Sure, understood.
Okay, any other questions?
No, that was helpful. Thanks.
Yeah, it's great. It's great to have that resource. I mean, this is wonderful. We hope to see a lot of you.
Yes, and I don't know if my email's on there, but if there's ever specific questions, I'm always happy to answer things as they come up.
Okay, thank you very much. All right, Tess, what do we have for the director's report?
I really don't have any specific updates other than we're continuing, with the ongoing work in terms of opioid settlement funds and the grant that Michaela's a part of in terms of trying to expand that. Some of the team members on this call, we're getting them geared up for the new software that we'll be utilizing. So those trainings are going to happen the end of this week and next week. And then the inspectors will be able to utilize that software to help just create a more streamlined approach for them in the field. And then also Michaela will be able to do some more data analysis by pulling reports with the use of that software that will help us overall. So just moving forward in those ways. And that's pretty much it for my piece. But I do just want to, yeah, so that's all I have.
What are we hearing about St. Anne's? And have you heard anything else?
I have not. I haven't heard anything other than what I'm hearing in the news.
Right.
I haven't been contacted by anybody at the state level in terms of making any preparations for anything.
I saw one reference in a longer news article that there were several deficiencies found there by this monitor that the state sent, but I wasn't able to determine, what the impact of those would be, and if is it just wondering if there's anything going on in the community. I don't know, Dr. Gagliardi, if you've heard anything over you, Tom. I haven't.
I mean, the things I've heard, St. Anne's is one of the only profitable hospitals.
They're a better performer than some of the
Yeah.
others. What I heard, yeah.
But they're all affected by the same account, so they're not able to provide services because, like, when I go there, there's no robotic supply, so you can't do that surgery, or you have to do it a different way. Laundry, basic things, which when you don't have them, you can't do certain things. But they're still getting new stuff, so they're hanging in there as far as I know. But as far as the overall picture, and there's so much debt with that company that someone higher up is going to have to fix that.
Right. But the impact on the public health in this community will be significant if they do close. Although we're fortunate in some of the other communities where they have a hospital, we do have another institution in this town. But
Yeah, I think someone would step in before that happened.
I hope so. Yeah. Okay. I just thought I'd raise it as something that we need to pay attention to going forward. Not that there's much within our power to address the issue, as you were saying. But
We'll make a declaration.
yeah, right.
And if I hear of anything, I'll be sure to keep you all informed. But again, yeah, the state hasn't reached out and I
Yeah.
really haven't had any formal conversations with St. Anne's.
Maybe they'll call in the National Guard. Always seems to be helpful.
Did we
Hey,
receive, did
If
we
they can run
receive,
the laundry, you know, maybe that
Yeah.
might, yeah.
I don't
Did
know how
we-
good they're gonna be at nursing, but we'll see.
did we receive anything under citizens input?
No, we have not received anything.
Okay, next would be to confirm the date for our next meeting. Following our past schedule, the last Tuesday in March would be the 26th. Does that sound okay?
Sure.
Excuse us?
Yep.
Do we not have Liliana Dias on the agenda today for keeping of animals?
No, there was no other keeping of animals agenda items today. At least. And
She was
Sandy, I don't know if
informed-
you're able to come off mute.
I was told to
She was
come
informed to come today. This is why she's here. She had difficulty last time with the
to connect.
calling in, and she was trying to call. She was actually speaking to Sandy downstairs during the whole meeting. So she's here today.
They told me to come in today.
Okay, where is this from?
This is for Meridian Street for the keeping of animals.
Mariano,
I'm sorry.
Mariano Bishop
I
Boulevard.
apologize, Mariana Bishop.
Boulevard.
Again, it's not on the agenda. And we tabled it the last time because twice no one had appeared for the meeting.
Well, I didn't know the first time, and the second time I couldn't get through it. I don't know, was my phone or was,
Again, it's not on the agenda today. We'll be glad to take it off the table next time.
why I was told to come in today at 3:30.
Ma'am, it doesn't appear on the
And-
agenda.
And to bring the check and
So it wasn't, yeah, like Chairman Corey's indicating, it wasn't on our agenda. I don't know if Sandy can come off mute, but because it wasn't on the agenda, we're not able to move forward with that. I'm not sure how that was communicated to you in terms of coming today.
Well, Sandy told her when she was on the,
when I was on the
when she
phone.
was having that difficulty last meeting, she was on the phone with Sandy. So, but that's if it's not on the agenda, they can't take it up. So,
I understand, but I was told to come in, you know what I mean? I took the time to come in.
apologize for that. So I guess we
Well, we certainly apologize for any misunderstanding, but because of open meeting law rules and such, it's difficult for us to just add things to the agenda at the, without them being publicized in advance. But we'll work with you to make sure that those things don't happen next time.
All right,
We're sorry.
that's okay. I mean, it happens, but
Tess, can you check whether we're still able to hold Zoom meetings? In the back of my mind, I thought that expired sometime in March.
I will double check. I don't believe so, but I will double check.
They
I thought that
extended it
had been
again. March was the original, but it was extended again, and I think eventually it's gonna be made permanent, but it was
Okay.
extended again.
Okay, so the 26th looks good?
Yep.
Okay, anything else? Was there anything else of such a nature that it couldn't make the agenda?
No.
Okay, can we have a motion to adjourn?
So moved.
Second,
Can we have a roll call?
Thomas Corey,
Yes?
Michael Coughlin,
Yes.
Stephen Gagliardi.
yes.
Okay, thank you all. Have a wonderful rest of the week.